So let me grab myself a seat so we can get started. Welcome to my home, or as I like to say, Dr. Balsama's neighborhood. So I am Chris, Dr. Balsama's bariatric nurse. I've been a bariatric nurse a long time, a nurse for over 35 years. Dr. Balsama has been a surgeon many years. I think it was around 2005 that he graduated. Either way, class 2 will be on stages 1 and 2 of your post-op diet. I do want you to go to Dr. Balsama's Advocare website, advocaresswt.com, and you can download the presentation of this video, and you can also access the video. Now, the whole purpose of these videos is just to enhance your nutrition education prior to surgery. If you have not yet already, do look at video 1, which is on your diet management prior to surgery. This video is on your diet management after surgery for the first 2 stages. So make sure you have the PowerPoint that you'll look at as I go through these slides. And I'm actually going to look at the slides just so I don't miss any valuable information. So stages 1 and 2 of your diet, the whole purpose of these stages, there are 4 altogether, is to allow your stomach to heal, make sure you get really hydrated, and to acclimate your stomach to getting food again. Rules that we'll review first. You never want to eat and drink together. So we have a rule called the 30-30 rule. 30-30 rule means 30 minutes prior to eating a meal, during your meal, and 30 minutes after your meal, no drinking any kinds of fluids. The reason is your stomach is really small and you just cannot fit fluid and food in there at the same time. Start practicing that now, because most people always eat and drink with their meals, and we have probably encouraged you to eat and drink with your meals up to this point in time, but after surgery you cannot do that. Solid lean protein for life. We did talk about lean protein in video 1, and refer back there so you know what solid lean protein is. You will not be consuming solid lean protein until stage 4 of your diet, and that will be a separate video. Self-monitor. You must hold yourself accountable. Left to our own resources, we are our own worst enemies. We need something to keep us in track. There is absolutely nothing wrong with that. We are human beings, and as human beings, we are just not programmed to do things right all the time. So we need to build fortresses for ourselves. So one fortress is self-monitoring. You get to pick whatever it is that you want to monitor, that you know you will monitor. So what are some things? You can monitor grams of protein eaten every day. You can monitor calories. You can monitor your weight. I would not recommend any more than a weekly weigh-in. You can monitor the shrinking of your belt with counting holes on your belt. You can also monitor the sizes of your clothing that shrinks. You can monitor steps walked every day. You can monitor minutes of exercise that you do. Either way, pick something to monitor. And if you do, you're going to be a lot more successful with your weight management after surgery. My volume on? Oh, I guess it's on. If it's not, I guess I'll have to re-record this. So, stages 1. We don't always want to emphasize protein in stage 1. The number 1 priority in stage 1 is hydration. You want to push your fluids. You can, however, have 1 protein supplement. I only recommend 1 protein supplement. Others may recommend more than that, but excess protein can dehydrate as well. So we want you to focus on hydration, water, Crystal Light, sugar-free Jello, sugar-free popsicles, chicken, beef, vegetable broth, any flavored less than 15 calorie beverage you can have as well. So stage 1, the protein that you'll get is what you're getting in your protein supplement, anywhere between 20 and 30 grams of protein. Stage 2, you may be able to increase that to 40 grams of protein or so. One protein supplement, plus you're going to be introducing some protein foods like cottage cheese and yogurt. Stage 3 may be 50 to 60 grams of protein. And you'll stay around there. If you're a really tall guy, you can try to focus on 60 to 80 grams of protein. When you get back to see me for your first post-op visit, I will calculate your individual needs for protein. But until that time, you follow what my protein guidelines are for you. It takes about 6 weeks to get up to your regular food stage. And remember again, your regular food stage is a protein diet full of plenty of lean protein and plenty of vegetables. Low carb, low fat. That is your diet after surgery. So in the hospital, that's when you're going to start stage 1. You'll be in the hospital overnight only. The following day after surgery, you'll get a clear liquid tray. That starts day 1 of your stage 1 diet. And again, it may be broth, sugar-free Jell-O, diluted fruit juice, decaffeinated tea or coffee. You might even get a protein Jell-O at the hospital. Water, G2 waters, even though, let's say something like Sprite Zero sounds like a clear liquid, remember it's carbonated, so you cannot have any carbonated beverages. So when you're in the hospital is going to give you one of these little 1-ounce medicine cups, and you have to demonstrate the ability to drink out of this before you will be discharged home. Now, they may tell you, fill this up and every half hour try to get an ounce in, which is important early on because you don't want to gulp, and if you drink too much too quickly, you're going to have pain and it will discourage you from drinking more. But once you're home from the hospital, you got to up the ante a little bit, because if you don't, you're going to get dehydrated. So 1 cup every 15 minutes of some fluid, then 1 cup ideally every 10 minutes for your first 4 to 5 days. That's how long stage 1 lasts. You're going to fill this medicine cup up with something. So when you wake up, let's say 8 o'clock, make it an ounce of water. 8:10, maybe an ounce of decaffeinated coffee. 8:20, maybe an ounce of your protein shake. 8:30, maybe an ounce of Crystal Light. 8:40, maybe an ounce of some sugar-free Jell-O. 8:50, maybe another ounce of water. 9 o'clock, maybe an ounce of Crystal Light. And you're going to repeat that every hour. Now, if you fall asleep, don't worry. But the minute you wake back up again, you have to start your 1-ounce sips of this fluid. Once you get into stage 2, that's when you start to introduce a little bit of food. Remember, you can't eat and drink together by 30 minutes, so you will have 4 meals in stage 2. So that's 4 hours out of the day you're not drinking. So hopefully you'll be able to drink more than 1 ounce at a time. Maybe you'll be able to get 2, 3, 4 ounces in more easily, which will help you compensate for the hours of the day that you're not able to drink. So remember, the goal in stage 1 is hydration. You're on stage 1 4 to 5 days. And if everything's going well, meaning you're not throwing up, you're not nauseous, you feel good, then you can go to stage 2. Let me touch base on some protein shakes, because that's one of the slides. There will be on the website a sheet with acceptable protein shakes. You can buy any protein shake outside of that list, providing it meets our guidelines. So when you look at a protein shake, this is the one I like. It's a Premier Protein. This happens to be strawberries and cream. It's not one of my favorites. Premier Protein makes probably the most variety of flavors. I am not doing a commercial for you, Premier Protein. It just happens that I like this, and I do drink them myself. I like the caramel and vanilla protein shakes. So this meets our requirement, but there are plenty others that meet our requirement as well. So a protein supplement should have a minimum of 20 grams of protein per serving, no more than 3 grams of fat, and then no more than 5 to 8 grams of carbs. Usually they're around 160 calories or so. So if you see something else in the store that looks appealing to you, you can buy a different one than what's on the sheet that I provide for you. So again, we're going to review the liquids allowed in stage 1. Vegetable, chicken, beef broth. Remember, low fat, maybe low sodium. Although if you drink something with some sodium in it, it'll probably encourage you to drink more. So early on, we may not be so concerned about sodium. Sugar-free Jell-O, Crystal Light, sugar-free popsicles, decaffeinated tea or coffee. You can mix your powdered protein. If you buy a powder protein, you can mix that in water, skim milk, or almond milk. If you mix it in water, whatever amount of water you want to mix it in. If you mix it in milk, make it skim milk, no more than 8 ounces. And almond milk, the 30-calorie almond milk, you can use a little bit more almond milk. But remember, always just 1 scoop. These powders come with scoops. Some of them will say use 2 scoops, but you will not. You'll get too much protein. Just 1 scoop of your powder. Sugar substitutes are okay, like Splenda, Truvia, Stevia, Equal. Remember, any of the beverages that you do drink should be less than 15 calories. When you're in the hospital will give you maybe some G2 waters, which have a little bit more than that, but it's loaded with electrolytes and really good for you. But generally, you want to keep your beverages less than 15 calories, other than your protein shake or the milk you're adding to your protein shake. So priority stage 1 is hydration. The number 1 reason people get readmitted back to the hospital is dehydration. So you really want to focus on that in stage 1. You'll continue to focus that in stage 2, and I'll touch on that when I talk about stage 2. So we gave you the typical day layout, every 10 minutes how you're going to drink. Refer back to your slide to remind you of how to do that. Hopefully you can print these out and have them available. Everybody will start a vitamin in stage 2. We'll start a couple of supplements in stage 2. We do not want you to start them in stage 1. You take vitamins on an empty stomach, and you're actually have an empty stomach if all you're doing is introducing fluids. In stage 2, you will be introducing some full liquid foods, which give your belly some substance. That's when you'll start your vitamins. So you'll start stage 2 on day 5, but you'll start your vitamins maybe day 7 or 8. So start stage 2 first. Make sure you're tolerating it. You will need to start a multivitamin with iron, or a multivitamin that doesn't have iron, and then also iron. You will use a vitamin B12, and depending on what you and I have discussed, it could be a nasal spray B12 called Nascobal. It could be a sublingual B12 that goes under your tongue. It could be a shot that your doctor gives you once a month. And there are patches for B12, but as far as I'm concerned, the jury's still kind of out with that, and I'm monitoring right now people's responses to the patches. So if you want to try the patch, you can, but I will definitely be checking your blood work to make sure that they are effective. The other nutrient that you'll need to supplement with, and the milligrams will depend on whether you had a gastric bypass or a sleeve, would be calcium citrate. Calcium helps prevent bone loss after surgery. When you lose weight, you do lose bone. So we must make sure that you're protected against that loss by supplementing with calcium that has vitamin D in it as well. And remember, you're going to start these supplements in stage 2 of your diet after you've started stage 2. So stage 2 lasts 7 to 10 days. And this is called the full liquid stage, even though the items on stage 2 don't sound like they're liquids, but we consider them full liquids. So such thing as yogurt, preferably Greek. In our practice, we do allow it to be flavored. The yogurt I like best is Dan & Layton Fit Greek yogurt. You know what? These companies ought to give me a bonus, which I could then turn around and make in professional videos. Wouldn't that be nice? Either way, the Dan & Layton Fit Greek yogurt has 12 grams of protein in it, and it has only 80 calories. So I may do a slide on label reading, but if you look at that, where'd it go? That's a nutrition label, and you scan down and you'll see this has 30 grams of protein. So that's where you're going to look to see how much protein is in things. So if you look at a Dan & Layton Fit Greek yogurt, it has 12 grams of protein. So you can also have some things like cream of wheat, oatmeal, grits, but you have to really make them watery. You can add cinnamon to that. You can add artificial sweetener to that. Unsweetened applesauce, fat-free, low-fat whipped cottage cheese. If you can't find whipped cottage cheese, get your fork and whip it up yourself to break up the kernels. You can have cream soup, like cream and chicken soup, instead of broth. In stage 1, you had chicken, beef, or vegetable broth. Then you can have a cream soup. Condiments like cinnamon or your artificial sweeteners, you're allowed to add in this stage as well. Sometimes people will ask me about using baby food because that's kind of the right texture for stage 2. But baby food provides baby nutrition, not adult nutrition. So if you wanted to include baby foods, you can use that, maybe the flavor up like your cottage cheese. So that's the context in which you will use baby food. You will get 4 meals a day on stage 2. You're eating such a small amount that you do need to have more than 3 meals a day. But the quantity of food you will eat at each meal will be very low. So we say up to a quarter of a cup. So this is a half a cup. It's a rice pudding container. It's all broken apart because I haven't purchased any sugar-free rice pudding in a while. So half of this would be a quarter of a cup. A quarter of a cup is 2 ounces. So if you're not sure what 2 ounces, the measuring cup has labeled there 2 ounces. That's one way of looking at it. You could purchase a cup like this. It's a Bariatric cup. I think they even have them on Amazon. You can see where 2 ounces is. So it's a very small meal. Now again, you might not even be able to tolerate 2 ounces. Maybe you'll only tolerate a tablespoon. That is okay. Food is secondary. Primary is your hydration. Secondary is your protein. Thirdly is your vitamins. Food is bonus at this point, so don't overdo it. If your belly is not accepting of a quarter of a cup, you eat less. So anything a quarter of a cup or less in stage 2 is perfectly okay. Now, the foods you're eating in stage 2 really don't require a lot of chewing, but because this is food, you have to start honoring the 30-30 rule. No drinking 30 minutes before your tablespoon or a quarter of a cup of food. No drinking during, and you must wait 30 minutes afterwards before you can start to drink again. Your sources of hydration still remain important in stage 2. So in between meals, you're really going to have to get those fluids in. And remember, a good hydrating beverage is anything less than 15 calories. With coffee, by the end of stage 2, maybe stage 3, if you're not, at risk for dehydration anymore, you can add regular coffee back, providing you're hydrating. And remember, the evidence of good hydration is the color of your urine. If it's a light yellow or clear, that means you're doing a good job with your hydration. So, what other things? You can add some egg beaters to boiling broth in stage 2 to get some extra protein that way as well. Sample food menu for stage 2. It is on your slides, just to give you an idea of what a day on stage 2 would look like. Breakfast 8 a.m., a quarter cup of oatmeal. 12 p.m. and then half hour after that, you're drinking until 11:30, and then at 12 o'clock you'll have lunch, maybe a quarter of a cup of cream of chicken soup. 4 p.m., a quarter of a cup of yogurt. 8 p.m., a quarter of a cup of applesauce. And then in between all of that, you're getting your hydration in. You're also nursing a protein shake throughout that day in between your meals as well. You'll continue a protein shake through all your stages until you see me for your 6-week post-op visit. And at that time, we'll determine if you need to continue your protein supplements and also exactly how much you as an individual need of protein grams. Okay. Constipation can be a problem after surgery. So what causes constipation? Number 1, 2 weeks prior to the surgery, you were on basically a liquid diet. First week after surgery, you're on a liquid diet. So you don't have a lot of stuff in there to come out. So don't think you're constipated just because you didn't poop the first 4 days after surgery or so. But anything beyond 5 days or so, you probably want to get things moving along so you can use like a half a dose of milk of magnesia, a half a dose of Miralax maybe. There is a nice tea that you can drink at nighttime called Smooth Move Tea. You may find it as dieter's tea. You may also find it as slim tea. Taking a cup of that at night might be able to help you move the next morning. Physical activity helps with constipation too. Physical activity after surgery is crucial. The first thing the hospital is going to make you do once you've had your surgery and you're awake is to make you walk laps around the nurse's station. It gets the blood flowing, it gets the lungs open, it gets your digestive tract moving along again, so you're not building up gas and you're not getting constipated. If you choose a calcium supplement with magnesium in it, that could help with constipation as well. If most of the iron I'm recommending is the non-constipating kind of iron. So you'll let me know if you follow my instructions, you're getting a non-constipating kind of iron. Do know that iron is constipating, particularly ferrous sulfate. A lot of people can't tolerate that, so make sure that's not the iron in your supplement. A stool softener can help. It's a benign thing. It just softens up what's in there so it comes out more easily and you're not pooping pellets. So that's it for constipation. I do have a handout called the Constipation Cure. The handout has a homemade recipe in it that where you're mixing some homemade ingredients together that may help with your constipation. You can start that week 2 or 3 after surgery. I believe the handout is on the website. Gas. How does gas happen? Gas happens because maybe you've eaten something that promotes gas, or that you swallow air. Swallowed air is a big source of gas for our patients. You have a tiny belly and it can't accommodate a lot of swallowed air. In your larger sized belly you can. So how do you get to swallow air? Inadvertently. If you chew gum, you might swallow some air. If you drink out of a straw, you might be swallowing some air. If you like to talk and laugh a lot while you're eating meals, you are definitely swallowing air as well. So maybe keep quiet if you're having some gas problems around meal time. Sometimes people will get a lactose intolerance, so you may need to use like a lactate product or use only lactose-free milks. That can cause some gas. An overgrowth of intestinal bacteria. After all, we kind of manipulated your GI system, either removing your stomach with a sleeve or bypassing a part of your stomach with a bypass. So taking a probiotic may be a really good idea as well. If you would have intolerance to one food or another, that may present itself in your having gas, lack of physical activity, and narcotic use is a real big cause of gas. And it's also a really big cause of constipation. So I do get calls from patients after surgery, and the number one complaint I consistently get from patients is that either they're constipated or they're nauseous. And if they're using narcotics throughout the day, that's a primary reason. So my advice on narcotic use is maybe just take it at nighttime. If you feel like you're getting pain relief with something like Tylenol during the day, that's usually the best approach if that's possible. Now you may say, well, who do you think you are? You haven't had surgery. How do you know what this feels like to have bariatric surgery? Well, I haven't had bariatric surgery, but I have had a colon removed, and same laparoscopic surgery. You get your stomach removed. I had my colon removed. I know exactly what it feels like to be in the hospital. I know the kind of discomfort that is felt on your abdominal wall. So I have a pretty good idea personally of what you can tolerate and what you may not be able to tolerate. So use me as a resource. Also, my husband had a gastric bypass in 2003, so I have personal experience with him as well as my years of professional experience in taking care of all of our patients. Okay, treatment. There are some over-the-counter products you can use for gas, like Gas X. I would recommend you have some Gas X available. Once you're eating some food, if you eat a food known to cause gas like broccoli, you might want to take some Beano beforehand. Maybe don't drink out of a straw, maybe hold off on chewing gum. Lactate-free products. Ginger tea, I think, is one of the best all-time remedies for any belly issues as well. Now, when you leave the hospital, you will be told what medications to take, what to hold. Make sure you confer with your family doctor as soon as you get home, because some of those medications may need to be started back up again, or maybe one that you were told to stop, maybe you really should not have stopped it. So always confer with your family doctor. The medications that usually will need some changes will be your diabetes, high blood pressure, medications particularly. If you're on an antidepressant, you do want to take that as soon as you get home. Thyroid medication, you want to take that as soon as you get home as well. You can always run it by me, and I'll give you my best 2 cents, but I'm always going to refer you back to your family doctor. Medications to avoid. 2 weeks before surgery, you do have to avoid any NSAID medicine like ibuprofen, Motrin, but also any aspirin-containing products, Aleve, naproxen, things like that. And after surgery, at least for the first 2 weeks, if you've had a sleeve, for the first 2 weeks, you don't want to take any of those medications until you see Dr. Balsama at your 2-week post-op visit. And if you've had a gastric bypass, you really do just want to avoid those medications. Tylenol is always going to be the safest thing for you. There are many over-the-counter products you may question if you can have them. Cough syrups, you can get sugar-free, alcohol-free. If you need an antihistamine, if you need a Benadryl, if you need a nasal decongestant, those things are always going to be fine. If at some point in the future your doctor puts you on an antibiotic for something, that'll be fine too. You may want to take a probiotic though anytime you get put on an antibiotic. So there are some questions here, but my slide presentation is running a little over, so I am going to defer on them. But you take a look at them and try to think what the answers are, and then confer with me. I am available for my patients off hours, Saturday, Sunday, weekends when I'm on vacation. That is of my own accord. I love my work. I love my patients. It is not an inconvenience for me. Patients will sometimes say, oh, I'm not going to bother you on your day off. Well, if you don't bother me on my day off, I'm going to be upset. So get hold of me if you need me, and I really mean that seriously. There are support groups we highly recommend you go to. They are on the website. There is a mandatory class called the pre-op class that you need to attend at the hospital. There are exercise classes that the bariatric program offers. Please take advantage of them. We will follow you up for 5 years post-op. First year is more intense. 2 weeks post-op, 6 weeks, 3 months, maybe 9 months, 12 months, 18 months, and every year for 4 years. At intervals of time, we will be checking your blood work to make sure everything's intact. So we're going to take really good care of you. All right, so that's the end of your diet, stage 1 and 2. Stay tuned for stage 3 of your diet, which will be video number 3. So thank you for coming to my home. I wish you much luck, love, well-being, health, and always remember we are a family and we will always be here for you. That is my sentiment, that is my office's sentiment, and that is Dr. Balsama's #1 prerequisite, is that you are to be treated like family. Thank you and have a good day.